Straight to the news, striking healthcare workers say they are ready for talks with the government to end the ongoing industry action. Officials representing both nurses and clinical officers claim they have been neglected, vowing to soldier on until their demands are met. The striking medics lament that a lack of enough and quality personal protective equipment has exposed the frontline soldiers to the deadly COVID-19 disease. Purity Musewa, health reporter, spent the day with the medics.
This is Busia County Referral Hospital waiting bay. Patients are stranded without anyone to attend to them. Nurses and clinicians here are in solidarity with colleagues in other parts of the country and have downed tools demanding better terms.
Some of us tuko na familia, wengine tuko single mothers na watoto. By January next year watoto wote wanarudi shule, hatujui tutafanya namna gani.
We want to urge all our workers, even those ones who have not turned up to work today, that they consider coming back on duty so that the matters that they have raised, some of them have been addressed, some are still being addressed through various mechanisms.
The health workers say the workload is too heavy on them and the number of patients overwhelming.
Sasa mimi niko tu hapa, mguu inaniuma, wasiwezi kanyaga chini. Sasa hizo anatuambia, sasa hizo wamegoma, wananiambia mimi niende nyumbani. Na hii mguu sina vile naweza tembea. Tangu asubuhi leo bila mgomo imeanza. Tujakula chochote, tujadressiwa. Sasa mguu inaasha, sina vile tunaweza fanya.
Kuna nyanya yangu mgonjwa sana. Wagonjwa hapa wanatolewa lakini hawajapata nafuu.
Na madaktari wanasema wajawalipa. Sasa sisi kama walipe madaktari, nani watatudumia? Na tuko na magavana.
In Nairobi, nurses and clinicians would gather at Uhuru Park, Nairobi, to seek divine intervention and remember departed souls of their colleagues. Officials took the opportunity to remind the government of its duty to protect them as they take lead in the fight against the coronavirus pandemic.
Kwa hivyo sisi kwa kauli moja wanataka tueleze. Leo usiku wakikutuita tutakuwepo kwa ajili ya kutengeneza kauli ama kukubaliana turudi kazini. Lakini kwa sababu wameamua kwenda kwenye mgomo, serikali imeenda kwenye mgomo, haitaki kutatua matatizo zetu, basi tumesema tunataka kuwa join, tuende kuimba reggae na wao.
Kama ofisi ya Ombudsman, tumetoa advisory opinion kwa waziri wa afya na wale wakuu wa serikali waanze kushughulikia mahitaji na maslahi ya health workers.
The striking workers lament that many of their colleagues are dying from COVID-19 due to a lack of both protective gear and health insurance.
We are dying not because we want. We are dying not because we are careless. We are dying because we have been neglected and abandoned by the government and the employer, who should take care of us in our working places.
Ombi langu ni ministry tukikutana siku ya Alhamisi wao wamemalizana jukumu lao, pia jukumu la county governors, kwa sababu wengi ambao wako kwenye counties wako directly under the governors.
We have taken note of the concerns raised by healthcare workers and we continue to engage them in order to find amicable solutions to the issues of concern that have been raised.
They say at least 26 nurses and 10 clinical officers have died battling the pandemic ravaging the world.
The memory of healthcare workers that have lost the battle to COVID-19 lives on and burns bright. Clinicians and nurses have vowed to continue with their strike until their demands are met. Purity Musewa, Channel 1 News at Uhuru Park, Nairobi.